Right.
Namaste, ma'am.
Namaste.
Am I audible?
Yeah, you are audible. I doubt whether I am audible.
Yeah, you are audible, ma'am.
Others are to join, no?
How are you, ma'am?
I'm fine. Thank you. You have reached back, no?
Yes, ma'am.
After a long journey. So you are back to your routines.
Yes, ma'am.
Where is your co-host?
She's coming, ma'am. I think there is some problem with her net.
Oh. You can give a brief introduction about her.
One second, ma'am. Why it is not?
Ah, yes.
Namaste, sir.
Namaste. She's not able to join. If you couldn't join,
Do you both
am I
follow?
audible?
Yeah. Do you both follow Aditi on Instagram? I think
Yeah,
that
yeah,
would be good.
yeah.
Yeah. Okay. Hi, Aditi.
Hello. Good morning, ma'am. Good morning.
Morning.
Sir. Good evening.
And welcome to this.
Good evening.
Good evening. So we'll start, ma'am. Yeah.
Yeah.
So welcome everyone to episode 6, How to Learn to Understand Ayurveda. So myself, Sangeeta Singh from Bhopal and Aditi Raghavan from Bangalore. We both like to welcome our guest speaker, Dr. Rajkumar sir and Dr. Ramya Krishnan ma'am. Dr. Rajkumar sir, Associate Professor and HOD of Roganidana Vikriti Vigyana Department, Government of Puducherry, Mahi. Dr. Ramya Krishnan ma'am, Associate Professor and HOD Raviguna Department, the Government of Puducherry, Mahi. We both welcome you, ma'am and sir, in our episode 6. In order to proceed our episode 6, I'll like Aditi to brief the last episode, episode 5. Over to you.
Good evening to all. In the last episode, some basic points that we have covered include, firstly, the significance of Vata Vyadhi and why it should not be included under Majjavaha Srotas. Secondly, the importance of Dosha Avastha and Roga Nidana. Thirdly, the importance of learning Brihatrayi Samhita and not exclusively focusing over Charaka Samhita, but instead giving equal importance to all the Samhitas. Fourthly, the importance of providing a clinical OPD for all the subjects. And fifthly, and the most important point for today being how biostatistical evidence completely contradicts what Ayurveda preaches. So now I'll linger on the last point for some more time and progress my debate with Dr. Sangeeta. So coming to the core issue, which is the concept of biostatistics in Ayurveda. In our Swastavrita syllabus itself, there is an important point which is called health and statistics. And according to me, biostatistics is extremely important to prove medicine in the modern era. So the observations which are collected through meticulous studies, which come to a valid conclusion, which can be easily interpreted and understood by the people, is only popular through statistics. And according to the popular saying, numbers don't lie. So in spite of all this, how can you still say that statistics is not required in Ayurveda?
Yeah, Aditi, whatever you told about stats, Stats actually it is introduced in medicine chiefly in 1948. There was a study, Framingham Heart study, which was done in 1948 in 5,209 participants. So whatever you told, stats help, but what it does not and what confusion it creates, it's worth knowing. Like we know that every individual is different. So what contributes a heart attack in me is different than other individual who is susceptible to other factor. So this factor is not analyzed by stats, because in Ayurveda it is told Purva Aptopdesha Jnanam Pratyaksh Anumanabhyam Parikshayet. Pratyaksh and Anumana are led by Aptopdesh. Actually, the term Aptopdesh and Aptas are very much misunderstood nowadays, because like aptas are not eminent based medicine prescriber. Aptas are avitarko smriti vibhag vidho nishpriti up uptako vidhanasya. So they were not doing any spin of data. They were having unbiased thought. They did not want to make any result like what is happening. So cause effect relationship was explored by them, which is not possible by stats.
Okay. But I still have some more points to say. Like, what about the concept of risk benefit analysis, which is possible through statistics? Or how about, say, comparative analysis of a treatment and even observational analysis, like understanding the spread of a disease, the progression of a disease, about mortality and morbidity rates? All of that is possible only through statistics, right?
Right. Okay. What about what all you are telling about stats? What the thing which is being missed is that from Apurdesh we are able to estimate the lakshana of Vyadhi, Prakriti of Vyadhi, Vikara Swabhava. But modern, why they are emphasizing on stat? Because their science is not complete. They are evacuating unknown compound and calling it science. But in Ayurveda, Jnana Purva Karma, which matters, right? सर्व दोष विशेषज्ञ सर्व औषधि विशारदा विशक सर्वमायन हंति न च मोह निगच्छति. Means there will be no room for confusion, but stats is introducing confusion and probability, because probability itself is a confusion, right? So pratyakshatu hi yad drishtam शास्त्रदृष्टम च यद भवेत्. So we have to evacuate not only by observational led data, but also what is comprehended by science that we are doing. Jnana samudaya purva aptupdesham jnanam. Like we have to understand and look, and we have to perceive after understanding. So perception is always preceded by aptupdesha jnana only. Like इत्या आशेष आमे व्याधि यदुक्तम दोष लक्षणम दर्शने आदेय अभिहता. Darshan आदेय means what we are percepting is based on Ashesh Amaya Vyadhi Yatuktam Dosha Lakshanam. Dosha Lakshanam, which is told based on what we are assessing in the patient, and with pratyaksh and other factors. So, like acharyas are concluding, like they are saying ki sarvada sarva aloche yatha sambhav arth with arth adiyet vaset tatvam cha karye cha tad antaram. So we have to get an samagra gyan, means integral estimation, and also acharya charak told karye tat visheshagya pratipatto na muhyati amudha phalam apnoti yad moha nimajjitam. So, like, what is the purpose of doing research? Like, we do not do research for confusion and uncertainty. But what stat is creating confusion, uncertainty, and probability. But acharyas are specifically telling that we are doing research, and research is meant to remove confusion and not induce confusion and probability and uncertainty. So best research is meant to attain clarity and objectivity of the science.
Okay. How about I take the example of a very popular drug like, say, turmeric? It has multiple international patents. There are innumerable studies which are done regarding the use of turmeric, so much so that it has gained a lot of widespread popularity and usage. And statistics has this ability to take its specificity and provide it to the general public. So in this day and age, we can't completely avoid statistics. So how can you still refute the usage of statistics in Ayurveda.
Yeah. So as you told that about turmeric, right? So in modern protocol, randomized controlled trial or double-blind study, these two standards are their golden standard to like confirm or validate their things, right? But what their protocol is like doing randomized controlled trial and double blind study trial and telling that this is the golden standard to validate anything. But what actually they are doing, they are choosing unknown compound in unknown patient and revealing unknown data of benefit and risk. How that will help a particular patient, a specific patient of a disease condition, right? No way it is going to help that particular patient with a disease condition. What Ayurveda is advocating like you took the example of turmeric, right? So turmeric is having a medicinal property of Katu Ushna Katu. It is Ruksha and Lagu. So if you are give that, if you give turmeric to an in excess quantity to an dehydrated patient or a Pitta Prakopa condition patient, what will happen? Electrolyte imbalance might happen, hemorrhage condition might happen. So that will lead to some emergency condition or some other condition, chronic condition also that may lead. But what our drug is meant to be? Our drug is meant to be Tadev Yuktam Bheshajam Yad Arogya Kalpate. So what we are meant was to provide Arogya. We are not meant to provide some benefit or risk. If we will divide into two groups and we will just give our turmeric to two group of patients, what it will do, what we will find out? Nothing. Like even if we are giving turmeric to two groups and we are finding that the 70% benefit happened in 50 patient and 30% risk happened in this patient, it will be no use for a particular patient, as you told that a specific drug for a generalized public. But what Ayurveda is advocating a particular specific drug from a generalized to specificity, that we can use our drug to a specific condition, specific state and stage of the condition. Then we can what medicine is meant like Tadev Yuktam Bheshajam Arogya Kalpate. Then only we can provide that Arogya. Our objectivity of Ayurveda is Swasthya Swasthya Raksha Aturasya Vikare Prashnam Cha. So we are meant to reverse our disease condition and not just provide the benefit and risk of in the patient. So that was my point on that. That the randomized control trial and double-blind study is utterly waste of resource, time, and money in order to prove. Like if we are proving our science with modern parameters, it's like me walking in Rajkumar's slippers.
Okay, thank you, Dr. Sangeeta, and I agree with you. It is indeed an eye-opener to understand that RCTs and biostatistics in Ayurveda makes a mockery of the science rather than helps in strengthening it. And with this, I would like to proceed to the topic proper for today, which is Swasthavritta. Coming to our first question, Sushruta Sutrasthana chapter 4, Ekam Shastram Adhiyano Na Vidyat Shastram Nishchayam Tasmat Bahushrutam Shastram Vijaniya Chikitsaka. Sushruta in this chapter explains the importance of being well equipped with multiple sciences to avoid being narrow-minded and instead broaden our horizon to arrive at a good decision. Is this the reason behind including sciences like yoga and naturopathy under Swasthavritta? Can you please elaborate, ma'am, sir?
Good evening, all. Namaste, all. That sloka is misinterpreted widely. So it is so much misinterpreted. Like Ekam Shastram, you are learning one Shastra, right? Adhiyano. What is the meaning of Adhiyano? One who is learning. One who is learning a Shastra. Ekam Shastram Adhiyano na Vidyat Shastra Nishchayaha. He will not get complete idea or he will not get confirmative knowledge in that science. So he is learning a Shastra. So a student who is learning a Shastra will not get clarity in that science. Why? Because there are so many points which are taken from other Shastras. like Pancha Mahabhuta Siddhanta. So there is no definition of Bhutas as it is in Ayurvedic Shastra. So when we want to know more about Pancha Mahabhutas, we need to refer other Samhidas or we need to learn from Bahusrutaha, who is having profound knowledge. So Bahusrutaha Shastram Adhiye and Shastram you need to learn. So you need to learn from a person who is having profound knowledge, who is having expertise, who is proficient. So that itself is misinterpreted as you need to learn so many shastras. It is not like that. Tasmat bahusrutaha shastram vijaniya. You need to learn Ayurvedic science, only one shastra. Nahi egasmin shastre shakya sarva shastrani avarodham kartum. In one shastra, it is not possible to explain all the shastras. Like that, one Bhishak will not be able to learn all shastras, right? You cannot learn everything. In one context, it is mentioned as Brata Dame Emma Seva, Tyaga Shila Piyogo, Sarva Satveshu Maitri, Dada Sama Satyaparak, sorry, Shiva Sutta Tara Bhaskara Arathanani, Prakatita Mala Papam Kushta Munmulendi. So you need to practice Brata Dame Emma Seva, how to restrain your mind, how to direct your mind. For that, each and every individual is different. You have to adopt what Shastra says is the intention you have to understand and adopt in the patient. How it is to be made practical. That is more important. So intention is to be understood. For that, we need to know about all these things. Vyayamo sarva dosha nashana. That doesn't mean that a physician needs to be an athlete or a football player, or he should be going to gymnasium every day to build his muscle. It doesn't mean that. You need to know when to apply. Vyayama, the benefits of Vyayama, Lakavam, Dharma Samarthyam, Deepto Aknar, Meda Sakshaya, Vibhakta Khana Gatratvam, Vyayama Dupajayate. In the same context itself, when to stop Vyayama, Artha Shaktiya Nishebhyastu. So you need to tell the patient, you need to tell the healthy individual also when to do exercise, when to stop exercise, and what all are the contraindications. Vata Pittamayi, Balo Vrithu, Ajirnicha Tam Tejit. When you are having indigestion also, you should not practice exercise. So all these are to be explained to the patient. It's not like physician itself should be doing Vyayama and it's good for the physician, but he should be following all these rules, or the patient should be advised to follow all these rules. It can cause other diseases also if they are not practicing in the proper way. Adi Vyayamada Kasu, Joro, Gulma, etc. or Krishnakshaya Pratamago. Such diseases can also develop. So it is the intention is to be understood. What to do, where to do, how much to do, how much when to stop. All these intentions are to be understood by the physician. That is what is mentioned with Ekam Shastram Adhiyanu na Vidya Shastram Nischaya. So student who is learning a Shastra, so all Shastras will not be incorporated in one Shastra. So he has to Tad Vidyetyaha from experts. He has to get clarified. Then only he will get Shastra Nischaya. So he is learning only one Shastra. Tasmat Bahushu Shrutaha Shastram Vijaniya. So Shastram you will be understanding when you are learning from Guru. Guru should be Bahusrutaha. He should be knowing all these concepts with clarity. Shastram Guru Mukodgiranam Ataya Upasyacha Asakrit. So one who is learning from Guru, who is Bahusrutaha. So Guru should be an expert. Guru should be proficient, or he should be having profound knowledge. Yak karma guride vaidya sa vaidyo. One who has learned from a guru, who is proficient, he is termed as a vaidya. So shastrartha karma, who is practicing, he is a vaidya. Anyetu taskaraha. All others who doesn't know the shastrarthas and practicing intentions behind and practicing without considering. Just as you have been explaining, yoga masam tu yo vidya desha kalopa paditam purusham vikshya. So it is not a generalized thing. So biostatistics is a generalized thing, and from specific to general they are making. we are making from general to Purusham Vikshya Satneo Pishaguttama. So we have to be very specific. In that individual, how much exercise should be done. And also, there are many Deva Vyapasraya Tattva Atharvokta Pujitam. Deva Vyapasraya methods are to be adopted. So, Beli Mangala, Beli Upahara. You cannot be learning all these methods, right? Madhya Mamsa Sushilada is mentioned for Raja Ikshma Rogi. So, that doesn't mean that Vaidya should take Madhya and Mamsa, right? So, Madhya Vikraya Santhana Dana Banadi Na Acharya. You should not prepare Madhya, you should not sell Madhya, you should not drink Madhya. So, whatever is mentioned in the science is for health. So, Ayurveda Upadesha is for Karmartha Kama Mokshanam Arogyam Sadhanam Yada. What all are required for Arogya are mentioned. For that, you need clarity in that subject. Clarity, how will you get? You need to learn, you need to understand from experts. That doesn't mean that you need to learn yoga, you need to learn naturopathy, you need to learn vyayama, or you need to learn Veda Vaditra Ulsava Samskriti. You need to be a musician, or you need to be a puja, panditji. So all these are wrong interpretations that has happened in the society, in the teaching. So Bahusrutaha is Bahusrutaha Shastram Vijaniya. You should learn and get clarified the intentions of the Shastra. That's all. Or everything else is to be decided by the Vaidya itself.
Thank you, sir. Further elaborating on that question itself, for a layman and as well as for most Ayurveda practitioners, the concept of yoga and Ayurveda are almost like inseparable sisters. It is like one without the other. To what extent is this true?
Dr. Ramya, start.
I would like to clarify a point in the previous point also. Am I audible?
Yes,
Yes,
ma'am.
ma'am.
Actually, expert in Ayurveda means he should be, when it is written very clearly that Jnanamshena nahi jnanam krisne jneye pravartade bubutseda bishak tasmat tattvam tandrani shilana abhiyuktastu sadadam sarvam alochi sarvada na jadu skhaladi pratnyo vishamebi kriyapade. So it is by analytical knowledge, one will not be able to become an expert of everything. We cannot get a complete knowledge by accumulating analytical pieces of knowledge. Some yoga I am having knowledge, some naturopathy knowledge I am having, some astrology knowledge I am having, but Ayurveda also I am having some knowledge. So this some knowledge will cause so much problems. That's why Acharya told Abhiyuktastu Sadadam Sarvam Alochya Sarvada. Entire aspects of all the adding up knowledge, you should be added up knowledge, you should be able to analyze based on the main knowledge system which you are an expert in. If you are being an Ayurveda doctor, your main knowledge of expertise is Ayurveda. So first of all, if you study Ayurveda properly, only you will be able to estimate the utility of other systems which you are learning. Yoga is good, naturopathy is good, everything is good. But how you will analyze in this patient whether yoga is needed or not, whether it is good or bad, whether it will produce intended effects, that cannot be known by studying yoga and incomplete knowledge of Ayurveda. So that's why Acharya told, Na jadu skhaladi pratnyo vishamevi kriyapade. Even in difficult situations, a physician who is having integral estimation of knowledge in Ayurveda expertise and other systems, utility is to be examined. So in order to understand the utility of other systems, we should be having primary requirement, basic knowledge of Ayurveda, clarity and objectivity. It's not important that we should be knowing everything in Ayurveda. Whatever we know should be having fundamental clarity and objectivity. And we should be able to apply that knowledge in that particular situation and analyze and understand that situation where you want to apply the other knowledge. And third, when you should be approaching an expert of that particular knowledge. Suppose you want to know about the utility of yoga. You must know an authentic expert you should be approaching of yoga. You need not study yoga. You can understand from him the applied aspects of yoga in general. You can understand and apply that particular thing, whether it is required. Tasmat satyavi nirdeshe kuryat uhyam swayam dhiya. Vina tarkena ya siddhi yadurcha siddhi revaja. I am doing yoga in low back pain and getting good results. It's foolish to tell like that. It's really foolish. You cannot say like that. You are a scientific practitioner. Even your uncle might be also doing yoga and he might be relieving back pain. He might be curing back pain. What is the difference between you and your uncle? So it is very important. Nirdeshas have to be followed. Being a scientific practitioner, the priority is to be given to inbuilt diagnostic and treatment guidelines of your own system. Your own system. You are the master of your own system. Then only you can think of incorporating guidelines from other systems. So regarding yoga and naturopathy also, I don't think any direct necessity to learn deeply about yoga and naturopathy is existing in Ayurveda. First, because Ayurveda is a very complex and subtlemost and vast science. Ayurveda se paramparam tasmad apramattaha shashwat abhiyogam asmin gached. Always keep do learning of Ayurveda continuously till your life, throughout your life. That's what Acharya is telling. Vimala Vibula Buddhera Buddhi Maguli Guru. It can cause confusion to even vast and profound intelligent people. Then how about Alpa Buddhis like us? So in such a science, by incomplete knowledge, when you are going to learn yoga therapy and other therapy, I will say that it is complete injustice, total injustice to your own system, because you are not able to attain expertise in your own system. You don't know the basics of your system. When a yoga expert asks you, what is the standing point, what is the view of Ayurveda regarding this disease or this condition, you are not able to tell anything. Suppose you are not able to tell anything, then what for you are learning yoga? You should be able to, first of all, become expert in your own system. Try to become expert. There is no end of expertise. At least try to attain knowledge, proper knowledge, authentic knowledge. And nowadays, gurus are not standardized. So it is very important that you should be asking questions to yourself and gurus and make the intelligence clarified. Then only, otherwise I don't think any utility is there for yoga. Yes, for general knowledge purpose, it is good to read yoga books and approach yoga experts for knowledge. But getting expertise in own system is primarily crucial and vital.
What happening nowadays, ma'am, that they are mixing the principle of both sciences, and they are like this. They are advocating like in a prescription also there will be some medicine of Ayurveda and some yoga of asanas of Ayurveda. I mean yoga science. So that is what happening.
Yeah.
It is not happening for knowledge purpose. They are mixing, like they are considering both sciences are same.
Yeah, correct. It is a perfect example of Kriya Sangara. You are in one inflammatory status where exercise is contraindicated, yoga is advised, means it is Kriya Sangara, Ashuddha Chikitsa. It can cause new problems.
Not only that, yoga term which is defined in Ayurveda is entirely different from what is mentioned as Yoga Shastra. Yoga is Chittavritti Nirodha, what is mentioned in our science. So Chittavritti Nirodha is complete deactivation, or without any activity, the status of mind is called as yoga. So here there are no mentioning of yogic exercises to attain that state. So what we need to do is continuous practice of Jitendriya. Jitendriya is told in many places. For that, you can adopt any sort of method. So whatever I am doing, it's according to my circumstance. Tyaga Prajnaparadhana Indriya Upashama Smritihi. So how I am going to implement that is based on my knowledge level. So it is not by yogic exercises or some other things. If you practice vegetarian food also, you will not get Indriya Upashama. You have to practice certain things with which your Indriyas are under your control, so that you can regulate and restrain from Adiyogas or Indriya Adiyogas. You can restrain as well as you can regulate, which is termed as Dhamma. and directing towards wholesome things is yama. So all this dhamma and yama, how to practice is dependent on you. So yoga, what is mentioned is mentioned as yoga shastra is wrong. What is mentioned in Ayurvedic shastra is yoga chittavritti nirodha. No activities of mind, which can lead to moksha. Yogastu moksha pravartaka. So for attaining moksha means you are not having a thinking of yourself, and your mind and atma have become one, and you are reaching a state in which you don't have punarjanma. So that is what is intended with chittavritti nirodha and yogastu moksha pravartaka. Objective of Ayurveda is not that. Objective of Ayurveda is for health. So, Arogya is the main objective of Ayurvedic Shastra, and yogic exercises you can adopt or not. That is based on your knowledge in yoga, and there are so many indications where Vyayama is contraindicated, how to do Vyayama, when to stop Vyayama, everything is mentioned. Other than Vyayama, Atvagamana is mentioned, long distance walking is mentioned. In some cases, Chankramana is only mentioned. Even Chankramana can cause problems it can cause apana drushti. So, apano ruksha gurvanna vega thata adivahane yana yanasana sthana chankramais chadi sevide. Even slow walking, if practiced in excess, can produce apana drushti. So, all these are based on guidelines. What all things he is susceptible to, how to practice all those things, when to stop, when to start. So yoga is an exercise, so you can do whenever is required, and it will also add benefits. That is foolishness. It will not happen like that. So incorporating yogic exercises in this is absurdity and it's foolishness. Ayurvedic is entirely different science, which is based on yoga and arogya. Both. It is not absence of a disease is health. So I am not having any disease. That doesn't mean that I can do all sorts of yogasanas. Again, there are so many indications and contraindications. Even when you are having ajirna, you should not practice exercise. So a layman will not be knowing whether I am having ajirna or not. I am having a sama condition or not. How to assess a sama condition, a layman may not be knowing. In a sama condition, when he is practicing yogasanas, it can end up in other diseases, or that disease may manifest also, or it may aggravate also. So, yoga and Ayurvedic science cannot be, Ayurveda encompasses everything. Ayushyani, Anayushyani, Tripya Guna Karmani, Vedi Ayurveda. Ayurveda mentions everything. That doesn't mean that everything can be incorporated in Ayurveda, or everything can be incorporated in treatment. That is foolishness.
Thank you, sir. Thank you, ma'am. So my next question is, sir, in Ashtanga Hridaya, Dinacharya chapter, under Sadvrit Palan, it is explained, one shloka is written, Anuyayat Pratipadam Sarvadharmeshu Madhyamam. Is the intent of this shlok for us to be diplomatic? What is the true intent of this shlok?
Anuyayat Pratipadam Sarvadharmeshu Madhyamam. So, Sarvadharmeshu. So, Acharya is explaining all the dharmas, duties which are to be done. So, there are two types of ayus, sukhayus and hitayus. Sukhayus is physical and mental well-being is sukhayus. What we are doing for the patient is sukhayus. And hitayus is atma hita, or hita for the atma, which is social well-being and spiritual well-being. What we're telling. In Tharaniya Vegas, it is mentioned as Tharetu Sada Vegan Hiteshi Pretyacha Ihacha. In this birth as well as after death also. For Loka Ishya Dvesha Malsarya Ragadinam Jitendriyaha. He should be controlling all his addictions. Lopa, Ishya, Dvesha, Malsarya, etc. should be controlled for Hita Ayus, or for the Hita of Atma. So such things, this dharmas are explained. All the karma should be dependent on dharma. Karma should not be for sukha. Karma should be dependent on dharma, and then only sukham chandam bina dharma. Tasmat dharma varu bhavet. So whatever karma you are doing, it should be based on dharma. Then only you will get sukha. Sukha is mental peace or anukula vedaniyam sukham. So for that, what all things are to be done are socially, morally, and ethically right things are mentioned. That anuyayat pratipadam sarva dharmeshu madhyama. So if you are doing righteous things only, you will be getting peace of mind. So in that context, Acharya didn't tell that you should be diplomatic to become healthy or to get peace of mind. Anuyayat pratipadam. In all your initiatives, sarva dharmeshu, in all dharmas, you should be madhyama. Madhyama means without raga and dvesha, without attachment and detachment. So you should be unbiased in all your activities. So always, and telling lies is always, Dashvita, one of the Dashvita Babas is Himsastayam Anita Kamam Paishunyam Parusha Anurde. Anurda is lying. Hidam midam bruyat. Avisamvadinam. Avisamvadi pechalam. So it is mentioned as avisamvadi. Avisamvadi means always speak truth. It is not that Acharya told that you can be diplomatic and tell lie and escape from that. It is not like that. For your peace of mind, you should be always truthful. You should be always honest. Kale hidam midam bruyat. Avisamvadi pechalam. Always speak truths, and it should not be arbitrary. It should not be whatever comes into your mind, you can pechalam. Pechalam means whatever comes into your mind, you can escape by telling that this is because of this, and you cannot escape like that. So if you have to be dharmishta, you have to follow madhyamam, unbiased, honest. All your activities should be. That is what is meant. That is also for sukha use. So that is also misinterpreted one sloka. Anuyayat pratipadam sarva dharmeshu madhyamam. Madhyamam word is used. That doesn't mean that you can be diplomatic. It is, you should be honest and truthful.
Thank you, sir. My next question is that how we can apply the concepts of Ritucharya and Dinacharya in our day-to-day life, and how we can use it to improve our health, and if it is actually possible to incorporate all the practices mentioned for the betterment of our health.
Dr. Ramya.
Dinacharya and Ritucharya are those practices which are very general, which are to be followed for maintaining health or to stay healthy. Dinacharya, everything. A healthy person should consider these aspects with importance. So, being an Indian science, Ayurveda, we know that we from ancient scientists of Ayurveda were considering with utmost importance physical and mental hygiene. Not only physical hygiene, but also mental hygiene, because those times nowadays physical hygiene is considered with more importance. Mental hygiene is something which is completely neglected. But Acharyas have mentioned very clearly both these aspects. So what I understand is that this Dinacharya and Ritucharya are general practices which are to be adopted in healthy state. In healthy state is very important. When a subject is falling sick by any means, it can be any sort of sickness. It can be an external factor induced sickness, or it can be intrinsic factor oriented sickness, whatever it is. This Dinacharya is, or Ritucharya, whatever it is, it has to be modified in accordance to the patient circumstances, patient internal circumstances. What his condition is, that is what is called Tasmad Vigara Prakriti Adhishtana Andaranicha Samutthana Visheshamsha Buddhva Karma Machare. You have to understand the nature of the disease. Vikara Prakriti, not the patient Prakriti. Vikara, disease, nature of the disease. Tasmad Vigara Prakriti Adhishtana, Roga Adhishtana, and Samutthana Vishesha, cause mechanisms of the disease. We have to consider in designing the lifestyle of the patient from morning to night, whatever he is doing. So when we are considering Dinacharya of a sick person, It doesn't mean that he has to follow hard and fast rules. There are no hard and fast rules which are explained. Whatever is written is nirdesha. So as I told in the previous context, tasmat satyavi nirdeshe kudiya duhyam swayam dhiya vina tarkena ya siddhi yadricha siddhi revacha. So most important thing is shastra sahita tarka. When you are advising dinacharya or ritucharya to a patient, dinacharya when you are mentioning, you must understand the nature of the disease that he is having, the unique cause mechanisms which had led to that disease, and present state and stage of the disease. Whether he is in a position to take bath, taking bath is snana is advised in dinacharya. It doesn't mean that that patient has to take head bath if he is having urdhvajatru vikara. Some infection or something. So always disease, vikara prakriti, adhisthana and samtana vishesha. And regarding ritucharya also, there are so many misunderstandings. Ritucharya doesn't mean that a particular ritu comes, we have to follow. It is tradition. You must not confuse tradition with science. Acharya explained ritucharya for healthy people. And for sick people, what is to be done is to be decided by the scientific principles of estimation of disease. Rogamado pariksheda, tado alandaram veshujam, tada karma vishapashat. So when first we have to examine the disease, the patient, and then the treatment principle, which treatment principle or which upaya you are to apply in that particular patient in that particular period of time. Based on that, you have to decide the treatment. So Hemadri, Acharya Hemadri says all these satmyas, Desha Satmya, Kala Satmya, Dosha Satmya, all these satmyas, among all these satmyas, Ritu Satmya, most important satmya is considered to be Vyadhi Satmya. What is desirable for that Vyadhi in that particular condition, in that particular patient? That is to be considered at utmost importance. It is because of monsoon Ritucharya, monsoon Varsha Ritucharya is to be adopted. It is not like that. Even for healthy people, it is not like that because people vary their susceptibility. Nowadays, healthy people are not there. Those who are, most of the people are having multiple diseases and multiple medications, suppression medications. So we cannot consider them as healthy people. So when you advise blindly dinacharya and ritucharya to them, anything can happen if they are prone to develop, wrong dinacharya and ritucharya to them, it can end up in fatalities. So always science-based medicine, science-based thinking, rational thinking, Shastra Sahita Tarka is mentioned as golden standard in Ayurvedic decision making. Shastra Sahita Tarko Sadhananam, which means what? He didn't mention randomized controlled trial Sadhananam. He told Shastra Sahita Tarko. What is this Shastra? Shastra means Aptopadesha, what is explained in the science as Siddhantas, logics, principles, tattvas, adhadyose, tattvecha, karyecha, tadanandaram Acharya told. First you understand the tattvas, and then you think of what to do in the patient. Because it is monsoon season, do this. It's not like that. You are going far inferior to tradition practitioners when you do that. That is the point. Being a scientific practitioner, you have to apply science. If you are not doing, you are applying Ritucharya, then call yourself as Ritucharya expert, not Ayurveda expert. Do all the Ritucharyas and make money. It is also different kind of profession. First, you have to decide whether you have to be a scientific practitioner or a Ritucharya expert. If you want to practice Ritucharya, don't call yourself as Ayurveda doctor. This is my humble opinion.
Actually, this is part of physiology only. How diurnal variations happen, how nocturnal variations in our physiology happens. Based on that, from the perspective of dosha dushti or dosha vritti, it is mentioned what all things are to be done in respective seasons or in diurnal variations, nocturnal variations. It is from the perspective of day, night, and season. So that doesn't mean that everybody will be having the same status, right? All these are for anutpatyai samasena vithiresha prakashita. Nija agantu vikaranam utpannanam cha shante, for management of diseases as well as to stay healthy. Anutpatti means to prevent development of any diseases as well as nija agantu vikaranam utpannanam cha shante. For this, everything is explained. All these Vegas, all these diurnal, nocturnal variations. So, Ayurveda doesn't explain everything inside the body only. Everything in relation with external environment. So, during day, morning, when kapha increases, what all are to be done? When pitta stage happens, what all are to be done? In vatic state, what all are to be done? And during night also, and see, according to season, you have to change the food according to the season. But whenever it comes to treatment, Desha Kala Atma Vijnana, or according to Desha, according to Kala, but finally we are treating the disease. So according to the patient's disease status, we have to consider everything. That's all. Tyaga Pratnabharathanam Indriya Upashama Smritihi Desha Kala Atma Vijnanam. So all these are Satmurtasya Anuvartanam. So how to control my Indriya is to be decided by myself. So in my unique environment, what to do, how to do, etc. are to be decided. I will be having some problem in Varsha Ritu. I will not be having any problem in Sharad Ritu. So invariably in all, you cannot do Virejana Chigilsa or Vamana Chigilsa or Rekta Moksha Chigilsa. So you cannot adopt as it is. It is from the perspective of Ritu, Acharyas have explained. From the perspective of diurnal variations, nocturnal variations, Acharyas have explained. We have to assess the individual. Always it is the subject or healthy subject or disease subject. That is more important. So we have to incorporate everything according to the general rules. These are general rules. And when you come to specific situation, you have to consider only the subject, not all these things. If a subject is having a disease, you have to attend that only, not regarding. There is superiority. One Acharya Hemadri is explaining, and more than Desha Satmya, you need to consider Kala Satmya. More than Kala Satmya, you need to consider Desha Kala Prakriti Dosha Vyati Satmyanam Uttarottaram Balavat. More than Desha, you have to give importance to Kala. More than Kala, you need to give importance to one's Prakriti. If there is any Dosha Dushti, you have to give more importance to his Dosha Dushti only, not to his Prakriti. And if he is having a disease, Doshaja disease, you need to consider Doshaja Vyati only and not regarding Desha or Kala. According to Desha and Kala, you need to modify the form, the mode of application or the dosage, etc. can be decided. But most important is, so how to incorporate Dinacharya and Ritucharya is more important for a physician.
Thank you so much, sir. Very wonderfully explained by you. And as ma'am, as you told that you have given a new profession to a Ayurveda community for a Ritucharya expert and Dinacharya expert. And I thought that you are giving an chance there, okay, this profession also you can choose. But the comment came that nowadays Ritucharya and Dinacharya courses are also trending in market.
Yeah, that's right.
So already it is there. So my next question is, so infective fever, diagnosis is taught in Roga Nidana, treatment is taught in Kaya Chikitsa, but OPD is for Swastavrita. Why for infective fever we are taught all the modern management, as it is been told that infective fever or acute condition cannot be cured by Ayurveda, and schedule of vaccines are given for the same. Why not Ayurveda management and immune protection for same?
Yeah, your question itself has the answer. Nidana is taught by Nidana people, Chikitsa is taught by Chikitsa, and why it is given to Swastavrita? Same question. Answer is in the question itself, right? So as it is, as modern syllabus is incorporated in our science, they don't have a specific treatment for infective fevers. for viral infections. They don't have anything. Why bacterial infection is developing, they don't have a correct answer. So their management or their protective measures, their preventive measures, they will be taking meta-analysis, epidemiological studies. They don't have the cause mechanism effect relationship established. So how a jora develops is very well established in our science. Causes are mentioned, what all mechanisms can happen, what all types of fevers can happen, even if it is infective fever, in what all variations it can develop. So Samavada, Samapitta, Samakapa, Jora are different types of Joras are mentioned. So we have clear-cut cause mechanism effect relationship. In modern science, they don't have. So they will be going for epidemiological studies. So they will be considering one disease as pandemic, one disease as epidemic. So it's like that. They don't have a specific thing. So they have included that in preventive medicine. And only way to prevent that is by vaccines. What they are, according to their limitation or according to their view, only vaccines can prevent these infections. And so when we have adopted, when Ayurvedic syllabus incorporated MBBS syllabus, like preventive, what all things are incorporated in their syllabus is taken into ours as such, then everything is absurdity, right? So we have a clear-cut thing, and so that's what we are teaching in Roga Nidana, and we have got clear-cut treatment principles and how to incorporate in the patient is very well explained in our science, and treatment also means Kaya Chikalsa will be teaching those things. And Swastavrta is no way related to that. Word Swastavrta itself says that they should not treat diseases, right? So such term itself is wrong. And this vaccine related, we have got our own scientific explanations for Vyatik Shamatva. How there are so many terms. It's not like Vyatik Shamatva alone. Once Pragriti, Sara, Samhanna, Sattva, Satya, Ahara Shakti, Vyayama Shakti, Vayas, everything will be having an effect on his immune status. So we need to develop, or we need to teach students in a more precise manner that how we can prevent diseases or stay healthy. Prevention is different from health. So Kalartha Karmanam Hina Mithyadi Matraka Samyak Yogasya Vitneyo Roga Arogya Eka Karana. Karana of health is different from Karana of disease. So if you need to be healthy, preventing diseases will not make you healthy. You need to practice the karanas of health. Samyak yoga of Kalartha Karmana. So such theorems are to be taught, and the exact how to prevent or how to stay healthy, all these methods are to be incorporated in our science. Then only students will be confident. Now students will be thinking that only vaccines are the solution, and all the infective fevers you have to wear a mask and wash your hands and sanitize. That is the only method they will be thinking, because we have adopted the syllabus of Western system, and we are teaching that alone. And Swastavrta is given OPD also. So that's more confusing. So students will be in a totally confused state, as well as they will be ignorant of Ayurvedic scientific principles of infective fever diagnosis, management, as well as vaccines are the ultimate solution for these things. They'll be considering like that. That's all.
Thank you, sir. The next question is also a continuation of the previous question.
Dr. Remya would be adding something more, I think.
Oh, yes.
No, nothing. I just wanted to add that actually infections are the main thing where Swastavrta as such is not needed. That I will be telling in the coming paper. What is to be regarding an infective fever, every discipline in Ayurveda specialty is meant for teaching purpose. So for teaching Roga Nidana specialty emerged. for teaching. That doesn't mean that Roga Nidana experts should be only diagnosing the disease and sending to Kaya Chikitsa. It is not like that. For teaching the crucial, most subtle, most aspects of Roga Nidana, a Roga Nidana specialty. Like that Dravya Guna, but it is perverted now. Dravya Guna is meant for treatment, how to choose treatment. So the pharmacodynamics, kinetics, everything is in clinical aspect only. We can only teach pharmacodynamics of Ayurveda in patients. How in infection, what is the method of working of Ayurveda medicines. This in Dravya Guna classes, Dravya Guna faculties are to teach. What is the mode of action of Jwara Chikitsa in Ayurveda? What is the mode of action of Kasa Chikitsa in Ayurveda? What is the mode of action of what is called Shodha or Samadosha or Agni Mandya, Jirna, Gulma? What is the mode of action of each and every treatment principles in Ayurveda? This is something which is to be taught in a clinical setting by Dravya Guna. So it doesn't mean that infective fever means Kaya Chikitsa or as completely copied from modern medicine, social and preventive medicine, and they are treating infective fevers. They can only treat like that, or even Kaya Chikitsa can only treat. It is absolutely absurd because every Ayurveda, every specialist of Ayurveda is ultimately meant to become an expert of Ayurveda, and it is for attaining the Sukshma knowledge that PG is meant for. PG is meant to, BAMS is meant to learn Ayurveda. PG is meant to deeply understand and practice Ayurveda as science-based medicine. BAMS, all that you can do is learning Ayurveda because so much is there. But of course, you can learn the application of Ayurveda. But PG, it is meant to deeply understand the science and apply science. So what is happening today is blind mimicry of modern medicine. Blind mimicry of modern medicine. So Swasthavritta, social and preventive, Dravya Guna, pharmacology. So what is happening? Ultimately, students are losing their chance to get quality education. Definitely government, with all respect I am telling this, definitely the government of India must reconsider the policies of current education, current curriculum, current training. All these are to completely change. Then only we can expect a positive change, at least in the near future. Otherwise, students are losing their value of, if they cannot stay as Ayurveda experts, then what is the use of BAMS course? Actually, if they are to recommend vaccines to everyone, then why to learn immune system in Ayurveda? Then that portion can be discarded from the curriculum. Don't teach them Vyadhikshamatva. Don't teach them ojas, different aspects of ojas. They are learning right from Kriya Sharira, they are learning about ojas and its abnormalities, oja Kshaya, oja Visramsa, oja Vyabhu. Why to learn all this? Ultimately, they are meant to take vaccine. They are meant to wash hands and stay feared of infection. Then why to learn infective fevers? Why to teach Jwara? What is the role of Nidana expert? Why to learn? Why to teach these cause mechanisms of fever, different types of fever? It is like self-cheating, no? So Ayurveda is to emerge as an independent medical science. Independent medical science. It should have its own capability to establish, advance, and emerge scientific practitioners of Ayurveda. This is my point.
All subjects are clinical. You cannot make Swasthavrta for this, Yoga Nidana for this, or physiology for this, anatomy for this. All these are clinical subjects. Everything is clinical in Ayurveda.
Thank you, sir. Following your exact words which were used in your answer itself, we find that the entire syllabus for Swasthavritta is almost a mimicry of preventive and community medicine of the MBBS syllabus. Especially concepts like the concept of the nutrition schedule, the types of pollution, disaster management, concept of triage, etc. We are made to learn those with some vague correlation from Ayurveda, like say Janapadodvamsa Adhyaya. So when we are being made to learn this, is there any scope for its usage in a clinical setting, or is it just knowledge that we are meant to accumulate as part of syllabus? How do we approach this?
Actually, I just did a small research in Swasthavrta syllabus. Frankly, I didn't go through Swasthavrta syllabus before because during my BA also it was a boring subject for me because So many things like yoga, naturopathy. I am not interested in that because I'm not able to understand Ayurveda first of all. Then apart from that, I have to learn all these things. But honestly, thanks to the organizing enthusiast students of this program, because of you only, I explored the Swastavarta curriculum for the first time in my life and career. So what I find is Swastavarta utility, Swastha Lakshana, okay, and Arogya Lakshana, WHO health definition also. These are my humble suggestions. Don't consider it as negative. I mean, the audience. Many people might be thinking she is blaming Swastavarta. It's not like that. Being an expert of Ayurveda, how Swastavarta is intended to be learned and practiced. That is what the program is aimed at. So please take it as a constructive criticism or remark, whatever you feel. So the thing is that Swastha definition, Swasthya definition, everybody knows what is Samadosha, Samadosha. That is what is to be primarily educated. And health definition of WHO, actually it is based on many other things. I won't say that it is complete, but for general knowledge it is okay. And then everything else like Dinacharya, Ritucharya, Sadvritta, Trayobastambha. Okay, all these are the points. Roga Nirpadaniya, in that all that Veda Dharana, that chapter complete. All these Swastha Rasayanas, all these are to be included in basic principles. Basic principles of healthy living. There should be a chapter in basic principles in first year. Basic principles of healthy living. Under that, all these things should be taught. All these like Trayobastambha, Ahara, Nidra, Brahmacharya, Yoga Nilpadaniya chapter, Swastha Rasayanas, Ashtanindita Purushas. It is to be taught in basic principles first year. People, they are learning something clinical point of view also, application of basic principles. Ashtanindita, that can be shown in the OPD by basic principles specialist. Specialist is meant for teaching that speciality. Everybody is meant to be a specialist of basic principles. That is different thing. But as far as they must be attaining clear-cut knowledge, sukshma level knowledge. So this Ashtanindita Purushas should be included in the basic principles first year. And they should be shown, Ashtanindita Purushas should be shown in the OPD. Whether anybody is there, among any of these. And menstrual hygiene, I have seen in Swastha, menstrual hygiene. Definitely, it is to be taught in the basic principles of healthy living in the first year. First year itself, students are to learn all this. And then part B, it is absolutely waste of time and waste of what you call precious time of students. For faculties, we are ready to teach anything, whatever is provided in the curriculum, because we are paid for that by government or private, whoever it is. But ultimately, being an honest faculty, dedicated faculty to my profession, I feel that it is injustice to teach yoga and Nisargopachara in Swastha. Because it is not, because students are not learning Ayurveda. Students are not learning Ayurveda. Otherwise, one general knowledge can be given as an additional subject in first year. General knowledge of other health systems. Just like Idihasana. I think now it is not there, no? Idihasa. Idihasa is there now first year?
Yes, ma'am.
Sure. Okay. Like that, one not compulsory subject. In that, yoga, Nisargopachara, if they want, they can attain knowledge on that. And paper 2, all these Vayu, Jala, land, all these waste disposal, pollution, disaster management. Okay, it is fine to understand what conventional medicine is doing in these aspects. It is okay to understand as a general knowledge. What is recommended to be done in Ayurveda on these aspects? How we can purify all this environment? What specific guidelines we can adopt, being Ayurveda scientific fraternity, what we can adopt to do to check environmental pollution. That is to be explored and updated. That has to be emerged in national policies, state and national policies. Ayurveda guidelines for environmental pollution, whatever things. Now in Kerala, we know what happened. So like that, many chances of much pollution are emerging. So it is to be not only taught. It is not to be taught as story alone to students. These things are to be incorporated in policy making in state and central government. And Why are no immune protection measures? They are not included in state and national strategies as priority. Why it is not prioritized? These things are very important. As long as students are learning, we are practicing this as an independent medical science. It is really important that Ayurveda decision making is to be independent and intended for decision making in policies. This is my humble request to the policy makers also. And epidemiology, as Sangeeta told, epidemiology has very limited. Like we are not considering association. We are considering causation only in Ayurveda. There is like cigarette smoking associated with development of heart attack or cancer. There is no association in Ayurveda. There is only causation, no correlation. So we must be learning the subtlemost aspects of Rogaridana to understand how much susceptible a particular population is or patient is for developing disease. So epidemiology as such has limited value, and primary healthcare, another suggestion is Ayurveda should be adopted as primary healthcare. Primary healthcare, so much value is there. So this family welfare, all these in Swastavrta, they are learning MCH, prevention, vaccines, nutritional, national nutritional programs. Why should Ayurveda students learn all this? All these educated by the Western medicine, why should they learn? Is Ayurveda not mentioning all these things? MCH, prevention of disease, vaccine, nutrition. Ayurveda has nothing about all that. If Ayurvedic science is having all these things, then why we are supposed to learn all the things what modern medicine is educating, blindly ignoring the Ayurvedic part, Ayurvedic perspective, scientific perspective of the same? That is my question. We are supposed to learn Alma Ata declaration, the national health programs, all these things students are learning. No, is there any single program of Ayurveda in national health program? Maybe some worm infestation or anemia or something you will tell from somewhere. That is not what is enough. No, there should be vast projects in Ayurveda for national health programs. There should be. Now we are having so much pandemics, epidemics, so much are there. So we can do such a big contribution to India. We can make India #1 in care and cure of infective diseases by scientific Ayurveda strategies. SPB can do that. SPB has submitted a proposal to do that. So once it is done, how much confident these Ayurveda students will be? They will feel that they are becoming doctors. None of them will prescribe paracetamol. None of them will take paracetamol even because they know how to do. They can educate masses of public. They can educate schools, school children, parents, their own families extending to society, state, nation. And other countries will be envious of us. What is this Ayurveda doing? There are no emerging infections or pandemics or deaths or calamities by infecting fevers. What are these people doing? Other countries will be jealous. They will be asking how to implement Ayurveda in their professional education. How they can emerge government Ayurveda hospitals in Europe. Nowadays, we are doing business and we are trying to establish science in Western countries. We can never establish a science by business. I tell you, with underline and signature, you can never expect to establish the scientificity of a science by doing business. You can do only by your actions. Karma vistu anumiyande. Nanadravya guna. By quality karma, quality education, quality decision making, quality communication, quality action. You must be able to explain what you are doing. Transparency, predictability, repeatability of logics. All these are enabling us to stay as it is. So Swastavrta is not at all a subject, independent subject required in the curriculum. Swastavrta, all the things which are included in Ayurvedic part can be divided in other, mostly basic principles, and in other subjects wherever required. And this national program, modern medicine oriented things, Alma Ata declaration and what you call MCH, prevention. Okay, WHO, about WHO, so many things to study, right? World Health Organization. For general knowledge, we can understand there is an organization called World Health Organization. how we are bound to them. We are not slaves to WHO. We are having an independent medical science. Our medical science is not insisting us to adopt WHO. WHO should learn Ayurveda. It's not that Ayurveda doctors should learn WHO. WHO should understand the importance of Ayurveda, independence of Ayurveda, and we have to educate them regarding what is Ayurveda, what are the policies required in Ayurveda. This is what is to be done. No, otherwise it is slavery. There is no independence for Ayurveda in the whole century even. That is my point.
Both systems are entirely different. Concept of health itself is entirely different from Western science, and methods to become healthy as well as how diseases are developing. Everything is different from Western science. So it is no way it could be substantiated that MBBS syllabus could be incorporated in Ayurvedic one. Our Dinacharya, Rutucharya, etc. are meant with the basic principles of Ayurvedic science. It is not like that. So, Nitya Rasayanas are told, Satyavadinam Akrotham, or Sadvrta, the word itself is for practices, sincere effort for, Vrata means sincere effort for social and spiritual health. So, what all things are mentioned in Ayurveda should be taught, and like micronutrients, macronutrients, students are so much confused and they are misled, because when they come out also they will be thinking of, I am not getting micronutrients, I am not getting macronutrients. They will be thinking like that. I am not taking enough protein, I am not taking. So they don't remember even Shadrasa Madhura Prayam, Kale Satyam Shuchi Hidam. So Hidabhuk, Nidabhuk, Kalabhuk. When hunger develops, you have to take food. That also they are not remembering. Such a state students are emerging. Because of this, Western system is incorporated in our syllabus. That causes all these confusions and all this ignorance. And when students are naturally made slaves of Western system. They will be thinking of nutrients only. They will be thinking of this much exercise is to be done. They have to take this much breakfast. Everything quantified on the basis of such external factors. This much macronutrients are present. But what an Ayurvedic student or a physician of Ayurveda system needs to know is not at all taught, and not in the syllabus also. So that is the whole syllabus is to be changed, and what she told that first of the syllabus should be incorporated in physiology itself. It should start from physiology itself. When they are learning physiology, it should be in relation with their environment. Dinacharya, Rutucharya should be in relation with physiology, should be in relation with his environment. Also, that karma, etc., what all socially and ethically right, morally and ethically right things are mentioned. That can be taught in Sanskrit also, so that they will be learning all those things, and vaccine-induced toxins or vaccine-induced injury, all this can be learnt in Agada Dandara also, or in Dravya Guna Vijnana itself. So, all these portions, you need not consider it as a separate topic and incorporate modern syllabus in Swastavrta and make it another subject, just like Western system syllabus. And you are totally confusing and making the students ignorant. When they emerge as doctors, they will be very much diffident, and they will not be knowing anything regarding Ayurvedic perspective of nutrition as well as exercise or regimen, whatever it is. They are checking the modern things and again explaining all these diseases as well as giving advices to the patients. So that's a very, very much wrong way of teaching in Swastavrta.
Actually, one point is that this Western system, why we are learning? We are learning to enhance the confidence in Ayurveda. It's not that Western system should be discarded. I'm telling all these Alma Ata declaration, all these national health program, all these are to be discarded. Doesn't mean that Western medicine, every concept you don't need. It's not like that. Western medicine, anatomy, physiology, pathology, all these are required to be learned, not medicine. Medicine part is not needed other than pharmacology of every medication, what they are doing. It's very crucial. These things are to be learned to understand the things, because the modern age patient will be undergoing many medications from many systems, especially modern medicine, at least 5 to 20 medicines, and they are coming to us. So we should be knowing what is the status of the patient, what they have done so far. It is extremely important that modern medicine is to be there in the curriculum. But the ultimate objective of modern medicine is what? It is to enhance the confidence in Ayurveda. When we know that anti-inflammatory drugs are prescribed, what is the mode of action of anti-inflammatory? When we know that in SBEBA you know how to reverse inflammation faster, safer and accurate than anti-inflammatory, you feel proud of your science. Is it not, Sangeeta? What is your stand on it?
Yes, ma'am. Obviously.
Yeah. So this is the point. Students are to emerge as confident scientific practitioners. For that, other system is required. Conventional Western medicine is required because majority of people are following it as mainstream medicine, primary healthcare. This has to change. For that, quality Ayurveda doctors are to emerge. For that, this kind of rational syllabus and rational training is mandatory.
So first sloka which you told, you asked, no. Ekam Shastram Adhiyanam na Vidya Shastra Nishchaya. So in the present day, we need to know all the modern things and we have to be confident in our science. Shastra Nishchaya is confident in our science. So Ekam Shastram Adhiyanam na Vidya Shastra Nishchaya in the present era, because they are consuming modern medicines, they are doing so many other things which are not natural. So Tasmat Bahusruta Shastram Vijayaniya. We have to learn from other Shastras also to become confident in our science. That is what is mentioned by Ekam Shastram Adhiyano na Vidya Shastra Nishchaya.
Thank you, ma'am and sir. Actually, you covered the rest of the two questions I was about to ask. That is a Sanskrit subject is needed in our curriculum or not, or what is the significance of Sastavrita subject? Actually, Swastavita alone, the subject is which makes, I think, if I will talk about myself, Swastavita chapter subject is something jahan pe ekdam confusion, like on a peak, they are creating a confusion in a student mind by incorporating yoga, naturopathy, nutrition schedule, and other programs. What we are about to think that we can manage the disease with yoga, and it is also very important, and we have to add, and we do that, and then we study naturopathy. So because naturopathy has a different principles and we have a different principle, but when we study we are like that ki, okay, now which is true, what, how we can incorporate both of the things, because naturopathy having a nature word, so we think that yeah, it is Ayurveda only. Most of the common people also think that naturopathy and Ayurveda is same, but the principle is like entirely opposite. And when we study nutrition schedule, and that is like that is very much exhausting, because in second year we are learning about all the medicinal properties of everything we are learning in second year and in first year. And when we come in second year, third year, we will study all the nutrition value of like protein, carbohydrate कितना है, किसमें है. So even that the food जो competitions होते रहते हैं आयुष मंत्रालय से, so students are also like focusing everything कि इस food में इतनी calories है, इतना carbohydrate है, इतना protein है. They are not even want to know that कि उसका रस पंचक क्या है, how the karmas and everything, दोषग्न कर्म, रोगग्न कर्म, they are not knowing about all that things. And about the programs, you told that Ayurveda program should be there, but there is none Ayurveda program, all modern program which we study. So we think that this is the only way that infective fever has to be cured and managed, and like communicable disease, non-communicable disease, about that awareness, everything we think that कि ऐसे ही होता है हर एक चीज. So first 2 years they will just Ayurveda padhate हैं, and then third year they will just brainwash everything by incorporating everything in this Sastavrita subject. So I think the like I can't explain ki how I am happy that the explanation you have given about the subject कैसे जो है कि हम उसे upgrade कर सकते हैं. So like would anything you want to add on significance of Sastavrita? in Ayurveda?
Significance is it should be incorporated in other syllabus like in physiology, in basic principles, in even teaching of various dharmas. Karma should be always dependent on karma. Karma should be always dependent on dharma to attain sukha. So sukha is social, physical and mental well-being. So that should be taught in physiology itself, and dharma should be taught in Sanskrit also instead of that Supashidam. You can learn dharmas, right?
Yeah.
And you will be learning Ayurveda as well as Sanskrit along with that. And what all toxicities that are developing. And good hygiene and all are related with physiology only. And other things like Visha and all, Janapado, Tumsa, whatever it is, you can incorporate in Agada Tantra and also in Gavya Guna. And infective fever, there is no chance for any other subject. It's to be taught by Roga Nidana and treatment is to be taught by Kaya Chikitsa only. So, in brief, Swasthavrta, if you keep a subject like Swasthavrta, it will be completely misleading. Our preventive is Vyayamas Dikta Deeptatme Vayastha Belashalinam Virotyabhina Pidaye. Such concepts are not known. So, how to remain healthy? You cannot prevent diabetes and stay healthy. You cannot prevent heart attack and stay healthy. You may fall sick by other means. So when you are trying to evade diabetes, you may get other disease. So staying healthy or preventing diseases is by a general method, which is mentioned in Ayurvedic science as Vyayamas Nikta Deeptatne Vayastha Belashalinam Virotyabhina Pidaye. How to remain healthy is mentioned. That point itself is missed. So if you make it another subject and incorporate Western syllabus, so students will be totally diffident. So it has to be our request or my request is to make Swasthavrta include in other subjects and that subject should be deleted from the syllabus.
Thank you, sir.
I think it would
Yeah, yes, ma'am.
to take Aditi's opinion also on this.
I actually had one question which is maybe slightly deviating from the topic, but from the perspective of an intern, the Swasthavrita OPD almost becomes like a cosmetological OPD. Most of the patients that we see come for skincare or weight loss management, or who are generally healthy people who have some minor problem. So they generally are advised to go to the Swasthavrita OPD. So I just wanted to understand how this perspective could be changed, because it is mostly seen as a very commercial and cosmetological procedural type of outpatient department.
The thing
In the
is,
case of skin diseases, it is mentioned as Visha is one of the causes. Virutha, Visha, etc. are causes. So it is usually sent to Agada Tantra department. And Swasthavrta, all diseases can be considered as Swasthavrta, no? Because everybody is coming for health. Such classification itself is wrong.
so these
All are meant to be clinicians, all are meant to be experts in all diseases. It's not like Swasthavrta people are to take care of this. Agadadanta can be for this.
these patients are undergoing Swasthavrta department treatments will be mostly yoga and naturopathy oriented also. That is the most interesting things. Skin disease or weight loss, right? They will be on yoga therapies, right?
Yes, and there is the general expectation that as BMS practitioners, we are expected to teach them how to perform the yogasanas without prior knowledge of the yogasanas from our end itself.
I will say that it is our utter failure. It is our utter failure to need to depend on yogasanas to teach and train yogasanas to students by not knowing anything, by not able to apply even a single principle of Ayurveda logically in clinically teaching and training to students. It is utter failure of existing Ayurvedic education. It's a perfect example for complete failure of Ayurveda, conventional Ayurveda education. With complete pain, complete agony, I am telling this, even though I am smiling. I am telling this with complete agony, with a humble prayer that the situation changes in future, because students are not learning, not applying the principle of Swasthavrta in weight reduction also. They don't know Swasthavrta principles, what are to be done for reduction of weight. First of all, Swastha means obese person will not come in Swastha. That is another thing. But being an Ayurveda faculty and practitioner, those who are teaching this, they have the crucial responsibility to show the students the diagnostic principles of Ayurveda in obesity and the treatment principles of Ayurveda in obesity. They can show the results to students. That doesn't require yoga and naturopathy. They can show Ayurvedic principles in OPD itself. They can educate the patients what to do to cause weight loss. If they are having pimples, how to reverse pimples, how to make their skin clear. Nowadays, many funny things are emerging. Cosmetology, Ayurveda cosmetology with face packs, masks. I will say that all these are killing the authenticity of Ayurveda, quality of Ayurveda. We are committing suicide. When we are conducting such courses, it is nothing other than committing suicide. Our science is failing. Our science is failing to get projected because of our stupidity. It is because of our stupidity that our science is not getting exposed. We can sell, we can do business, whatever we want, we can do. If somebody wants to do cosmetology, they can consider themselves as cosmetologists. Don't call yourself as Ayurveda, because you are not applying Ayurvedic principles. Skincare principles means what? There is nothing called skin beauty principles in Ayurveda. In Ayurveda, everything is dependent on the subject-oriented things. You don't need to apply face packs to increase beauty in a healthy subject. Of course, we can apply face packs wherever required, but that too based on principles of Ayurveda. So, just doing something and foot massage, all these things, hair massage, foot massage, Ayurveda cosmetology courses I have seen. It is Ayurveda nutrition courses. I don't know what it is intended by all these things. I'm really sorry to say the truth, but it is painful. It is distorting the very authenticity of a medical system. I will say the most brilliant medical system in the universe, the science of man. It is spoiling the integrity of Ayurvedic medical professionals. It is defaming Ayurveda medical professionals. It is defaming professional students who are taking up BAMS with the hope that they can become doctors someday. Doctor worth for self, family and society. With that hope and prayer, they are joining BAMS. They are joining BAMS by passing entrance exam. Otherwise, if their option is to do business, why to go for BAMS? They can go for BBA, no, Bachelor of Business or something else they can do. Why to opt for Ayurveda? They are choosing Ayurveda, if at all, with the hope that they can become doctors someday. But if we are conducting such a training and such a teaching with a distorted curriculum, what is happening is we are cheating them. Intentionally and unintentionally, we are cheating them. If we remain silent throughout our life, we are allowing this injustice to continue. And this can continue for centuries. And the identity of the science will be completely spoiled. I'm sure there will be nothing like Ayurveda in future as it is. So please think about this, all the people who are watching this program.
Thank you, ma'am. As you said that अगर इसे ही अभी नहीं बचाएंगे तो Ayurveda as it is will not be remain. Very true. And I heartily thank you both of you. You have given a wonderful explanation on Swasthavrita subject, and every beyond that also you have explained that what the crucial time is, need of time is, and what we have to do. And also I just from my heart I'm saying that Ayurveda as it is, if anybody has been किसी ने भी अभी तक इसे जिंदा रखा है तो it is only SBBA and because of ma'am and sir. And somebody has
That's great.
asked
By God's
us.
grace.
Yeah, yes, sir. And but you too have like it's a great blessing for Ayurveda fraternity that we have such a great physician like you and ma'am. Somebody has asked about the next CME of SBBA. So in the next CME of SBBA is in Gujarat, 24 and 25 June, and the topic is musculoskeletal disorder. So to contact that, you can contact Dr. Nirja ma'am, and the details are has been shared in my FB account. I will share it in Insta account also. You can contact, you can DM me, and I can share her number or everything browser. So excluding that, thank you, ma'am and sir, for wonderfully explaining the things about Swastavrita. And we are very much thank you to both of you, actually.
So we should thank you also because of your incessant efforts, enthusiasm, passion, dedication to society. You are able to, I know that you all are facing a lot of opposition from many sides, many corners. I mean, the students who are aspiring for real science of Ayurveda, they are getting attacked, they are humiliated, they are tortured. They are undergoing great stress, immense stress in their career and life also. I mean, in their studenthood and life also at such a young age. But still, they are feeling confidence. They are putting trust on whatever they are taught. They are only because they are able to experience the difference between what they have seen, what they are seeing outside, and what they do now. Only because of that, they are able to trust the scientific knowledge, what is being rendered in SBBA. So thanks to you also, and thank great God for enabling us to understand the truth, at least a fraction of the truth. Otherwise, we would have been in the same community who will be praising whatever things we find around as something wrong or anti-Ayurveda things. But thank God that God has given a hammer strike on our brains and at least made us irritated or tensed so that we will be able to spread the spark of irritation or motivation to others. So thank God for that. Hare Krishna.
Thank you both and the team behind.
Yeah. Thank you, sir. Aditi?
I actually wanted to add that during the discussion itself, a lot of genuine things came up where at some point, I think Dr. Sangeeta can also agree that we actually felt why these things were included in the syllabus, or genuinely questioned a lot of things that maybe during third year we would have just ignored and just read. But like now at this point, we were questioning many things. And for answering those things, we'll be very thankful to you, ma'am and sir.
So signing off, we will meet in the next episodes with another subject. Namaste, ma'am. Namaste, sir.